Hello, everyone. I'm Dr. Marty Ross, and tonight is another Conversations with Marty Ross MD. Looks like we got a large number of people here tonight, and I'm glad to see that. As many of you know, I've been off for the last 2 weeks, at least from doing these webinars. And so it's good to be back, and I look forward to see what you all have in store for me tonight. So one of the things I'm trying to get everybody to do when you write your questions, you have some options in that chat box area below. I want you to please click on the question mark icon that you see there and write your question to me only after you have clicked on that question mark icon. I am not going to respond to people that write questions to me without clicking that question mark icon. Trouble is this platform shows questions to me either through the chat thing you see there or the question mark. I'm only wanting to respond to the question mark, so please do it that way. So anyhow, I'll just make that point. We're going to spend about an hour and a half here tonight. I'm interested to see what you have in store for me. Know that I am doing a recording of tonight's webinar, and tomorrow morning, somewhere around 9 to 9:30 a.m. in the morning, I should have that completed and send you email notification that video is ready to be seen. It'll include the link to it too, but if you happen to not get that email, you can find a copy of the recording on the webinars page at Treat Lyme by Marty Ross MD, which is at treatlyme.net. Also, in that email tomorrow morning, you'll have a chance to sign up for the next 2 webinars. This is the first of 3 webinars that I'll be doing here in March, okay? So without any further ado, let's go ahead and one other thing. So I'm glad to see a lot of familiar names here on my message board, but those of you that are new, welcome. There's 2 ways to participate. One is I'm going to read the questions out loud that people write. And if you're in the live version, you'll actually be able to see those questions on your screen. So that's one way, is to hear the questions and see how I respond. Another one is to go ahead and write questions to me. And again, the way you do that is click on the question mark icon in the chat box area and then write your question only after you've clicked on that question mark icon. Okay? All right. So let's go ahead and get started here. Let's see. His first question is from Dave. Let's see. I've heard that taking a colostrum supplement can help treat Lyme. What do you think about that? Also, are there any specific colostrum supplements that you would recommend? Frankly, I don't see much benefit in using colostrum to treat Lyme. I mean, the people that would be advocating that are people that would say that colostrum helps your immune system to more effectively treat Lyme. Colostrum has substances in it that help your immune system, also have antibodies in them, et cetera. But frankly, treating Lyme requires a lot more than that. So I personally, in my practice, have not seen people have great benefit from it. So it's nothing that I advocate, actually. Thanks for that question. Hello, Tracy. Let's see. Lyme, chronic fatigue syndrome, POTS, et cetera, all in remission. I hope cured. I hope so, too. Let's see. Thanks mostly to your info for the last 5 years. That's great. I'm glad to hear that, Tracy. Let's see. Thank you. I now have mild, moderate mast cell activation syndrome, histamine issues. I'm fully vaxxed for COVID with typical side effects. What is your opinion experience with the shingles vax? And which one would you recommend? Thanks for all you do for us. All right. So the shingles, everyone, is basically chicken pox that reactivates as we get older. And people that are age 50 and above have an increasing chance that their immune system will lose the ability to keep chicken pox that lives in us. Even after we have chicken pox, we have chicken pox still living in us. It's just our immune system keeps it under control. But as we age, over age 50, our immune system starts losing the ability to keep the chickenpox virus under control, and a great majority of us will eventually develop reactivated chickenpox, and that comes out as something called shingles. And what shingles is chickenpox that distributes itself on the skin in relationship to our nerves. One of the big problems when you get shingles as you get older is by itself, it can be very fatiguing and painful, but sometimes the painful areas don't resolve after the shingles goes away. Okay. The shingles vaccines have all been shown to be fairly effective. The one that is the probably the most active and then one that works best is something called the Shingrix vaccine. And even I have had that. So I just want to let you know that's the one I would do. It's the one I've done myself, actually. And so what you'll see with the Shingrix vaccine is that people do get just like when you get the COVID vaccine, most people get some surge in their immune system, and that causes a release in inflammation cytokines, right? Many of you have heard me talk about cytokines. Those are in Lyme disease and in mold toxicity and in yeast overgrowth syndrome. The reason you feel badly is that your immune system in trying to deal with those infections is manufacturing cytokines. Cytokines are good and that they turn the immune system on, but in certain conditions, the immune system gets too turned on, tries harder and harder, makes too many cytokines. And it's too many cytokines that make you feel fatigued, make you ache, make it so you can't think, cause you to have body pains, disturb your sleep, et cetera, et cetera. So Lyme symptoms are really too many cytokine symptoms, okay? So when you get your Shingrix vaccine and when you get your COVID vaccine, for instance, that triggers the immune system to get turned on. And one of the first things the immune system releases are cytokines, right? So when you get these vaccines, it can make it look like your Lyme got activated, but what really got activated is cytokines. And usually it's about a week or so for most of those cytokines to get back to normal range. So when I had the Shingrix vaccine, for instance, I was clobbered pretty hard, actually, and I don't have Lyme, but I got very fatigued and very achy for about 24 hours. Even wound up taking a day off of work, but then recovered very well. And I still haven't had my second one yet. You're supposed to get one, I think, 6 months apart. So I'm going to be due to get my second one coming up. But I would recommend it. I don't see any harm, any adverse reactions that occur more in people with Lyme than don't have Lyme regarding this one. And I do think as we get older, there is greater risk of harm coming about from reactivated chickenpox. And so I do suggest getting this one. Okay. All right. Thanks for that question, Tracy. One of the things you could do to limit the amount of herxing, or not herxing, but cytokine symptoms, which are the same symptoms that occur in a herx too, is when you get the vaccine, go ahead and do curcumin, 500 milligrams 3 times a day. The product I like for that is Thorn Mariva 500. Curcumin gets inside of white blood cells and limits cytokine production. And then if you get it and you're also really kind of having difficulty, you could also use glutathione, liposomal oral glutathione. The product I like for that is a product made by Research Nutritionals called Tri-Fortify. Okay. And I would do 1 teaspoon once or twice a day if you're having quite a bit of cytokine symptoms as a result of getting that vaccine. Okay. All right. Thanks for that question. Hello, Dave. Let's hail Dr. Ross. So my wife and daughter got hit with COVID. I didn't get it. We are all vaxxed. I strongly believe your advice on taking vitamin C, D, zinc, curcumin, quercetin, and glutathione prevented me from getting COVID. So thank you. You're welcome. Questions. 1, since I didn't get Omicron this time, does that mean I am immune to Omicron, or can I get it next week or next month from another exposure? 2, if you have recovered from COVID and should at least have 3 months of antibody protection, do you still wear a mask, or can you take a break from wearing them for at least 3 months? Thank you. That's a good question. And actually, some things that I've looked at too. So when you get, so let me just talk about what happens when you get COVID. So when you get COVID, even if you're vaxxed, there are the breakthrough infections. The vax was never meant to prevent infection. The vax was meant to help you deal with the infection better once you got it. Okay, so I want to be very clear about that. And what the vaccines do is they prevent bad illness, basically. And even with Delta before Omicron, and definitely with Omicron, they have prevented that. So what we know, what the science seems to be telling us is that when you get Omicron, not only does your internal immunization or immune system get turned on, so does your external ability to fight infection too. And let me tell you what I mean by that. All right. So when you get COVID, that activates it turns your body's antibodies on. And so you're going to have more circulating antibodies in your bloodstream and in your tissues to fight any germs that might get through your nose. Okay. But in addition, and those kind of antibodies are called IgM and IgG antibodies. Eventually, IgG is what gives you your long-term immunity. All right. The other thing that gets turned on once you've had the infection is your T cells that fight infections, or we call that cellular immunity, also gets turned on. All right. So think of your IgG antibodies and your cellular immunity as what is waiting for intruders on the other side of the door. All right. All right. But before something can get through the door, they got to get to your front porch. And think of your nose as the front porch. There's nothing before you get COVID, and even as a result of getting the COVID vaccine, there's no protection that happens on the porch. All of that protection is on the other side of the front door. All right. But when you get Omicron, there is a degree of protection you get on your front porch. And that is there's a type of antibody which are called IgA antibodies. IgA antibodies are antibodies that are on mucous membranes like your nose and your air pipe, okay? And we think that after you've had Omicron or you've had COVID infection, that for about 3 months, you've got increased levels of IgA antibodies that are grabbing hold of those germs so that they actually don't get through the front door and into your body. Okay. All right. So in theory, up to 3 months is what the data seems to be showing, that you would have increased protection on the front porch, as well as having increased protection with your IgG antibodies and cellular immunity on the other side of the front door. All right. I hope you all understand my analogies I'm making there. So the question is, do you need to wear a mask? And I think it's a very individual question. I think we all have to decide what risk we want to take. In general, you should be very protected with those IgAs. And also, even if something were to get through, you are supercharged inside on the other side of the front door from having had the infection. Okay. So in my own decision making, I made a decision to stop masking. And so, for instance, the reason I wasn't here last week is I was vacationing down in Florida, and I spent the whole time down there without a mask on the whole time. I did wear my mask on the airplane, but in all other avenues, I chose not to because I had COVID right around Christmas. So I'm still in my 3-month window of having some super protection. It's not 100%. I want to be clear about that. But I decided that even if my IgAs did not capture those germs on the front porch, that my immune system inside my body was so supercharged that it should prevent me from getting bad infection or even a moderate infection. So I made a personal choice to not wear a mask. But I think everyone has got to make that choice for themselves. So are you 100% protected if you get COVID from these IgAs and your supercharged immune system on the other side of the front door? It's not 100% protected, okay? But you're pretty safe, all right? So that was my own decision. That's what I did, and I think it's a fair thing to consider as well, too, all right? Now, in terms of are you immune to Omicron? Probably not. You may have just gotten lucky. Or you did get it. You may have had a subclinical case. You may have had a case that you got it. Your immune system did really well since you were immunized and you didn't get symptoms from it. And the trouble is there's no way to know. Okay. So just keep that in mind. All right. All right. Good luck to you, and good luck to your family too, Dave. Hello, Rich. Let's see. These webinars are incredibly helpful. Good. I'm glad. Thanks for doing them. Can you talk about Thorn Isophos, which is phosphatidylserine isolate? I believe you sell this on your website. Do you recommend this for your Lyme patients? Would this also help with nerve and mitochondria repair in a similar way ATP 360 does? Can it also help relax you? So phosphatidylserine is a phospholipid, a fat, okay, that is a component that is used in our bodies as a part of the cell membrane, especially your nerve cell membranes. So your cell membranes, whether it's a nerve cell, a skin cell, whatever, is made up of a bilipid layer of fat, two layers of fat, okay, of phospholipid fats. And so the main component, one of the larger components of nerve cell membranes is phosphatidylserine with a little bit of something called phosphatidylcholine in it, okay? All right, then your mitochondria, which are your cell energy factories. So every one of our cells has an energy factory system. There's about 300 to 400 mitochondria per cell. Inside these mitochondria are where sugar and fat are burned through a bunch of chemical reactions to create cell fuel. Cell fuel is something called ATP, all right? And those mitochondria membranes have a little bit of phosphatidylserine in them, but have a greater amount of phosphatidylcholine in them and a few other types of phospholipids as well too, all right? Now, when you're trying to do repair of either your nerve cell membrane or your mitochondria membrane, it's probably better to do it with a mix of phosphatidylserine and phosphatidylcholine, because again, both of them have phosphatidylserine and phosphatidylcholine in them, although nerve cell membrane is more serine than choline, mitochondria more choline than serine, but it's a mix, all right? So when you talk about doing nerve cell membrane, mitochondria membrane repair, things like the ATP 360, which is a product made by Research Nutritionals, is made up of a phospholipid complex, of which there's phosphatidylserine, phosphatidylcholine, and I believe there's a few other phospholipids in there, in addition to some micronutrients that mitochondria need to run. That product, ATP 360, is probably would do a better job than using just phosphatidylserine alone, again, because your nerve cell membranes and your mitochondrial membranes also have these other phospholipids in them. Okay, all right. But I will use phosphatidylserine when I do have somebody that cannot tolerate an ATP 360 or cannot tolerate an NT factor, which is another way of getting these in. Sometimes I will use just the isolated phosphatidylserine if they can't tolerate these products that have more types of phospholipids in them. Okay, so you could use it for mitochondrial repair. There are some people also that find that phosphatidylserine is useful at inducing sleep. And so that's another reason to use a phosphatidylserine as well too. Okay, all right. Good luck to you, Rich. Thanks for that question. Hello, Megan. Let's see, Dr. Ross. Where would you go with medication or supplements with someone who has tried your herbal and prescription antibiotic options for Lyme and Bartonella persister busters and is still not well? I have cleared mold toxins and gone through heavy metal chelation as well. I have taken biocidin for biofilm in the past, but nothing now. I am beginning to feel like I've exhausted all options. Any suggestions that come to mind? Leber kinase. Thanks sincerely. So Megan, there's not a simple answer here. And this is where it would probably be useful if you had a Lyme literate medical doctor or naturopathic doctor that could help hear your story and try to figure out how to weave through this in a different way. So it's, and let me say more about that. So the, although I fully support people taking charge of this thing and trying to treat the best way they can. There's sometimes you just need to get the expert advice of somebody that can look at this with you. So last about maybe a year or two ago now, LymeDisease.org, which is a group based out of California, has been operating a research project that they call My Lyme Data. My Lyme Data has, I think, around 14 or 15,000 people enrolled now. These are people living with Lyme that allow questions to be asked of them, and they get to be queried periodically to help answer questions. All right. So My Lyme Data, I think about a year and a half or 2 years ago, their big annual research project for the year was to try to ask the question, what for people that got better from Lyme, what was it that worked? That's kind of what the question was. All right. And they specifically looked at people that either got all the way well or were in a category they called high responders. Okay. And so what they found, there were two key things that made it so that person was a high responder or got all the way well. This is what their data showed. Number one, being on antibiotics. Now, I don't know if in their questionnaire, if they made a distinction between prescription antibiotics or herbal antibiotics. Okay. But what they were really trying to say is being on something that's a germ killer. Okay. Number one. All right. And it appears that for people with Lyme, the ones that got well, that in their study, it was people that were on these antibiotics for a year or more. So it's using them for a long time too. All right. And again, I think they were asking the question prescription antibiotics, but I would argue herbal antibiotics are effective as well too, just based on my experience. Okay. All right. All right. But the second thing that they showed that was instrumental in somebody getting well was working with a Lyme literate medical doctor. All right. The people that stood the best chance of getting better were somebody that could overlook at things and come up with ideas particular to your situation. I mean, this is a complicated, you know that. I'm not saying something you don't know. It's complicated. I know a lot of stuff, and it's still complicated from my standpoint too. I mean, there's a lot of times I'm sitting here with somebody thinking, oh my God, what am I going to do next, right? And that's with all the information I have, all right? So, you just need, I would suggest if you haven't been doing it, I would definitely consider getting a Lyme literate medical doctor that can help look at this with you, okay? All right. Good luck to you, Megan. Hello, Tim. Hi, Dr. Ross. I hope that you are doing great. I am. Thank you. Let's see. I was wondering what the best way is to get rid of liver flukes in a Lyme Bartonella patient like myself. Thank you so much. I would have to research that. I don't know that one off the top of my head. I'm thinking biltricide may be an antiparasitic that targets flukes, but I don't know off the top of my head. And the question I would wonder is, how do you know you have liver flukes? You may know that for sure, but before I start treating for liver flukes, I would want to make sure you actually do have liver flukes too. All right. So I would have to investigate. I don't know that one off the top of my head. All right. Thanks for that question, Tim. Good luck to you. Hello, Sita. Let's see. I noticed some of the reference ranges for what is normal vary between Quest and LabCorp. How come? With my recent Quest CBC and CMP test, my hemoglobin is low, 11.5. My AST is high. My urea nitrogen is low. Creatinine low. Sodium slightly low. Is any of the above a cause for concern? I'm 37 years old, female. Also, what tests do you recommend for someone who suspects thyroid issues due to very cold hands, non-growing hair, fatigue? Is dry skin potentially a thyroid issue? Thank you so much. All right. So, Sita, so first of all, the way that normal is determined, and each of these labs would have to, with the test kits they use, the company that manufactured that test kit would have to go out and determine what is normal for the test kit that they have, okay? And basically what we do is we pull a bunch of people off the street that are defined as normal, and we that are healthy, and we see what is the range of results that they get for each of those tests. We artificially say that people that fall within 2.5 standard deviations of the mean are normal. So you probably remember from schooling this idea of a bell-shaped curve. So the bell-shaped curve goes up like this and down. All right. And so people, everyone that has had like a sodium level will fall somewhere underneath this bell-shaped curve, okay? But we artificially say that 2.5% of people at this end and 2.5% of people at this end are abnormal. All right, we artificially say 5% of people are abnormal. That's how we define normal. We basically pull a bunch of people off the street. If they're healthy, we look at the distribution of their test results and the tail ends of those test results. We artificially say they're abnormal, but they may be your normal, okay? So with these, my quick interpretation here, and I am not your physician, I want to be clear about this. You really should talk to your doctor about this who knows your history well enough to know if these are significant. My look at this for an average person is that these would not give me great concern because they're all close enough to normal. All right. But I'm not your doctor. I don't know your whole history. I don't know everything about you to say if that's true. But for the average person, I would not be too concerned about this. But I want to say it again, you should talk to your own doctor about this because I'm not your doctor. Okay. All right. All right. Now, the second thing is in terms of thyroid, the only way to know if you have low thyroid, and yeah, some of these symptoms you're saying, cold hands, non-growing hair, fatigue, those can all be parts of low thyroid. For that, I would get thyroid testing. And the testing I would do would be to get a free T4 level, which is T4 is one of the thyroid hormones made by your thyroid gland. I would also get something called free T3, which is another one of the thyroid hormones that's made by your thyroid gland. And we get TSH. TSH is a chemical made by the brain that talks to your thyroid and says, make thyroid. All right. So if you have a high TSH, it means the brain is screaming at the thyroid to make more thyroid because the brain doesn't think there's enough thyroid. So high TSH means low thyroid. All right. So you need to check a TSH. And then finally, I usually will include something called a reverse T3. And typically, most conventional doctors don't check that one, but those of us that manage chronic illness do. And the reason is what reverse T3 does is it measures your body's ability to convert T4 into T3. So your thyroid gland up here, about 90% of what it makes is T4 thyroid hormone. It makes about 10% T3 thyroid hormone, all right? And then both those hormones go out into your body, to your liver, to all your cells. And inside the cells, T4 gets converted to T3. That's how it's supposed to happen. Okay. And what's active in your cells that makes it so your hair grows and so that you have energy is T3. But in chronic illness at the level of the tissue, so this is something called peripheral hypothyroidism, peripheral low thyroidism. There's a condition that can develop called peripheral low thyroid or peripheral hypothyroidism. And in that condition, out at the level of the tissues, the T4 doesn't convert to T3. It converts to something called reverse T3. So if you're building up reverse T3, it means you're not making enough T3, even if the levels are normal, okay? And that can happen in some fatiguing illnesses. We think the idea is that the body will try to put itself into hibernation to protect itself, okay? So the body is set up with T4 that the T4 can become either T3 or it can go over here and become a reverse T3. If you're building up a lot of reverse T3, it means your body's trying to hibernate. Okay. And what we usually will do in a situation like that is to actually give you T3, prescribe T3 so you get more T3 levels over here. All right. So a thorough way of looking at the thyroid is get a TSH, get a free T4, get a free T3, get a reverse T3. All right. And then sometimes I'll also do thyroid antibodies, TPO antibodies, to see if somebody has autoimmune illness as part of this too. I'm going to do a quick screen share and show you the comprehensive article I have on thyroid. All right. So take a look. This is Treat Lyme by Marty Ross MD. This is my online Lyme guide. Look at the hormone section here. And this is my article on thyroid illness, okay? And I talk about testing. I talk about that peripheral hypothyroidism. I even talk about what to do to support your thyroid as well too. Okay. All right. All right. Good luck to you. Hello, Lynn. Let's see. Hi, Dr. Ross. I've heard one functional medicine doctor recommend quercetin, SPM, which is specialized pro-resolving mediators, and PEA for inflammation. Do you have an opinion on these supplements for inflammation? Also, are there any supplements that reduce histamine in the brain? All right. So, I'm not sure what the SPM and the PEA are regarding the type, what they would do regarding the type of inflammation we see in chronic Lyme. Okay. The inflammation in chronic Lyme is due to excess cytokines. I mentioned those cytokines before. The quercetin actually can do a couple things. Number one, quercetin gets inside of white blood cells and it blocks a group of enzymes called kinases that are responsible for creating cytokines. All right. So quercetin can lower cytokine inflammation. The other thing that quercetin does is it helps to stabilize the type of cells in your body where histamines are made. All right. So it's known as a mast cell stabilizer. Mast cells are, the cells where histamines are made, and they will basically release those histamines when you're allergic to something lands on them, they'll release the histamines. Also, they sometimes will release histamines because they're turned on to release histamines by chronic infection, yeast, mold toxicity, stress and anxiety, virus infections. Those things are all things that can turn on the mast cells to more easily release their histamines, okay? So one thing you can use to stabilize your mast cells, which would then reduce histamine in the brain, is quercetin. All right, so the way that you use quercetin is as a 250 milligram pill, and that's 2 pills. Or Thorne makes a product called quercetin phytosome, and it's a 250 milligram quercetin pill, and you do 2 pills 3 times a day is usually how I'll have people use that, okay? Other things that you can use to deal with the inflammation seen in chronic infection is curcumin. Curcumin, which is a component of turmeric, the Indian seasoning turmeric, is very useful at blocking cytokine production as well. And that I like using a liposomal product that can easily get absorbed. And that's a product called Meriva 500 made by Thorne. And that's a 500 milligram pill 3 times a day. All right. One additional thing you could think of in terms of stabilizing your mast cells so they don't make as many histamines is another bioflavonoid. Quercetin's a bioflavonoid, and another bioflavonoid is something called luteolin, and it is much stronger at stabilizing those mast cells so they don't make and release as many histamines. And that's a 100 milligram pill, and that's 3 times a day that I would do as an adult. Okay, those are some things to think about. Let me do a quick screen share here for you. I'll show you a couple things. Oops, I guess that didn't work. Let me go back here. What did I do? Well, that's strange. I'm going to try that again. Oh, I see what I did wrong. All right, here we are. So I'm going to go back to my immune system chapter here. And then in terms of mast cells and histamines and what you can do to keep histamines from being released, take a look at this article called Mast Cell Activation Syndrome in Lyme. Okay, in here I talk about the quercetin. I also talk about luteolin in this article as well too. All right, and then in terms of the products that I recommend that I use with my patients for curcumin, what I like to use again is this Thorne product called Meriva 500. I find it very useful, very successful in terms of getting inflammation down. And then in terms of that quercetin product, I would use, this is the Thorne product called quercetin phytosome. That's what I wind up using in my practice. All right. And then finally, the luteolin. The product I like for that is a product called Neuroprotect. And a lot of this comes from fava beans, and they use a very clean process at making their Neuroprotect, so it's not full of contaminants, basically. Okay, so Neuroprotect, this is the product that I wound up using for my luteolin too. Okay. Regarding what I'm showing you here, so if you're ever wondering, what do I use for glutathione, or what do I use, what products do I recommend for anything, just type the generic name up here in the search box and you'll see, what do I use in my practice, all right? So you can use my supplement site just to see what do I use. You can also purchase from here too, and as many of you know, I don't charge taxes, and as long as you order products that are over $50, we'll ship it free to you as well too, all right? One thing about the prices that I have here, most of these manufacturers will not allow me to sell at lower than what I do. So I sell at the lowest price I can without having risk of losing the manufacturers letting me sell their products, basically. Okay. All right. All right. Good luck to you, Lynn. Hello, Keith. Let's see. I've been treating Bart for 2 years, and I want to do the Igenix Bart Immunoblot. Is there any value in doing IgM, or should I only do IgG? If you get a negative result, do you find that very accurate? Thank you, Dr. Ross. So it depends on what you're trying to do. If you're trying to do this test to see, did you ever have Bartonella, go ahead and do it. But in terms if you're trying to do this test to see if you still have Bartonella, there is no test you can do that proves you're done with the Bartonella treatment. There is no test you can do that proves you're done with the Lyme treatment. There is no test that you can do to prove that you are done with the Babesia treatment, unfortunately. Okay. Now let me explain that a little bit more. So this immunoblot is a method we use to see, are you making antibodies against the germ? So we have immunoblots for Lyme, we have immunoblots for Bartonella, okay? And basically, when you, there's two families of antibodies that are made. They're IgM and IgG antibodies. IgMs we generally recognize as being acute antibodies. They're what you make when you first get infected, and they are supposed to go away by around 6 weeks to 3 months, okay? Notice the word I said, supposed to. All right, so then after you develop IgMs, you're supposed to go on and make IgG antibodies. And IgG antibodies are the memory of your immune system, right? I mean, with COVID vaccine, think about it. We know that everyone, when they get vaccinated, they make antibodies. What they're making still at the end is IgG antibodies, right? Same thing here. Whenever you have an infection, it's IgGs that continue to circulate, and they are the memory of the immune system. So if you do testing and you get back IgGs, so what? It doesn't tell me whether the germ is still in you or not. I would expect you to have some IgGs in you, all right? And if you don't have any IgGs or you don't have any IgMs, it's possible the germ is still in you, but it's suppressed your body's ability to make the antibodies, all right? So having negative testing doesn't prove the germ is gone. Finally, there is a phenomenon that happens in Lyme, and more recently, we're starting to understand this also happens in Bartonella. And that is this model we have in medicine that you always get rid of your IgMs does not hold in Lyme disease, and it does not hold in Bartonella. All right. So we know, so with the Lyme infection, what we see is that about 50% of people that have chronic Lyme still keep making IgM antibodies. And they're chronic. I mean, these are people that have had it for a year or more, okay? And how we know that information, how we got that information is about 15 years ago, the National Institutes of Health funded 3 different research projects trying to determine if long-term antibiotics would make a difference, all right? And to get into these studies, they all had slightly different criterion, but essentially people had to prove that they had chronic Lyme. And these were people that usually had failed short course treatment. And in addition, they had to have positive antibody testing. So in the background data of trying to get people to enroll, the background data shows that of 50% of these people that had been previously treated that were trying to enroll in these studies were still making IGMs. All right. So, and we don't know why. I mean, there's some theories as to why it happens. We don't know why, but we do know it happens. All right. Now, more recently, IGeneX has been collecting some data or information about what it's seeing with its Bartonella immunoblot. And Dr. Burrascano, who's been one of their scientific advisors, Burrascano, many of you may know him. He's one of the pioneers of Lyme treatment in this country. He's not treating out of his office anymore, but he still does a lot of advisory roles. And Burrascano was reporting at one of the webinars we had on this new Bartonella immunoblot that they're starting to see some evidence that IgMs don't convert to IgG either in people with Bartonella. So you can keep making IgMs, it looks like, in Bartonella as well too, even beyond the acute period of the infection. Okay, so the big thing is there is no done test in any of these disorders. I know there's a bunch of my colleagues that are out there trying to repeat antibody testing and trying to use it as some sign that people are getting better. But the truth is it's not been validated. And there's reasons you could have negative testing. But again, keep in mind, it could be negative because your immune system is too suppressed by the germ to make the antibodies. Okay, so negative doesn't mean it's gone. Okay. The other test that a lot of my colleagues are doing is they're doing these tests called ELISpots. ELISpots measure your white blood cell, T cell activity against these infections. Generally, T cells are only supposed to live 2 months. And so if the T cells testing is negative, these ELISpot tests are negative, then that you could make an argument that the immune system hasn't seen the germ in 2 months, therefore it must be gone. Okay, you can make that argument. That's what a number of my colleagues do. But on the other hand, you can make the argument that the germs could be just partying on and raging in you, suppressing the immune system so the T cells can't even release their cytokines. Okay, so we have no validated tests that have ever been done that prove any of these tick-borne infections are out of you. The best we can do is rely on what clinically we see, unfortunately. Okay, all right. Thanks for the question, Keith. Hello, Dominic. Hi, Dr. Ross. Is there any way to know or find out if my Lyme Bartonella babesia has been activated due to a COVID infection? I got COVID last month and still feel horrible. I got bacterial pneumonia as well. I understand long COVID can resemble Lyme. Any guidance would be greatly appreciated. You know, there is not a standard way of looking at this. And it's really complicated. I mean, I have to face it with my patients too, because I have a number of people that have come in. Generally, what I'm telling people to do is we should wait to do anything to treat the Lyme infection or tick-borne infections for at least 2 months after their COVID infection. The majority of people with COVID will get back to their pre-COVID levels within 2 months. That's what I tend to see. If they don't, then I need to start considering, could it be Lyme reactivation? But it's more of a clinical sense that I go by. I don't go by a test. I just talk to the patients, try to get an understand what their current symptoms are versus the kind of symptoms they have with their Lyme. And if they're not getting better by 2 months, I will then have a discussion with them. If enough of their symptoms still look like Lyme or Bartonella or whatever, I will then have a discussion with them about whether we should try a trial of antibiotics again or not. Okay. But it's on a case-by-case basis, and it's based on what my clinical sense is. We don't have a test that tells us right now. All right. Thanks for that question, Dominic. Let's see here. Hello, Lynn. Let's see how Dr. Ross. Can Lyme cause low copper levels? If not, what else might cause this? I've been supplementing 2 milligrams daily over a year, and my copper is still low. Also, what do you think of boswellia for arthritis, pain, and mobility? All right. So I don't know the answer to your copper question. I would need to do my own literature search on that one. I don't know that one off the top of my head. Regarding boswellia is a useful anti-inflammatory for non-infectious causes of inflammation. All right. So if you've got like a wear and tear arthritis in your knee, giving you some pain, boswellia can help with those type of inflammatory chemicals. But if your pain is due to cytokines, I wouldn't look at boswellia as something that's useful for that. Okay. Again, cytokines are the inflammation chemicals that get made too much when you have chronic infection or mold toxicity in you, for instance. Okay. All right. Thanks for that question, Lynn. Hello, Tim. Let's see. I hope that you are doing great. Yes, I am. Thanks. Let's see. I was wondering what the best way is to get rid of. Oh, we already answered that one. Thanks, Tim. Hello, Gail. Let's see here. Kind of pull my glasses out to read this one. This is a little bit of a longer question, everyone. Let's see. I have positive TPO and my TSH went up to 10.7. All other thyroid labs are okay. My LND put me on 12 micrograms of Synthroid. 2 months later, TSH is 2.5. I saw an endocrinologist for the first time today. I am in the throes of transitioning into menopause, and I have severe night sweats and am barely sleeping. I am almost 55 and have irregular periods. They are triggered by moving. If I move even an arm, I break into a sweat. Have you seen movement in bed as a trigger for night sweats in perimenopause? The MD said that Synthroid dose is too low to bring down TSH. She said my menstrual pattern reflects variable estrogen levels, that this in turn will cause small fluctuation in thyroid levels that generally do not result in symptoms. When estrogen levels are less variable, thyroid function should be as well. I was asymptomatic for any hypothyroid symptoms. Do you agree with her? She says to stop the Synthroid and focus on HRT. She also said to use FDA-approved bioidentical hormones. All right. So I don't fully agree with her. Again, Gail, I'm not your physician. So I want to be clear. I don't get a chance to ask you 1,000 questions about your specific health, nor do I have a full sense of what your health history is. Okay, so I want to say that at the outset, but I'm going to give you some ideas to think about. All right. So endocrinologists and how they manage thyroid is a little bit different than many of us manage thyroid illness when somebody has chronic Lyme and chronic fatigue syndrome. All right. The endocrinologists focus mostly on that TSH level. That's what their training tells them to do. They have a feeling, a perception that if the brain is making normal levels of TSH, that the thyroid must be fine. Okay, that's their perception. All right. They also follow a different standard on TSHs. They believe that TSHs are generally normal if they're about 5 or less. Their literature also says that there isn't any real benefit in treating for TSHs that are even above 5 until it gets about 10 or higher. All right. They fully focus on that TSH. The trouble with their focus on TSH is what is normal. All right. So the American College of Pathologists about maybe 10, 15 years ago now changed their standard of what they thought a normal TSH should be. And they started reporting that TSHs should be at 2.5 or less. Most labs still use the old system, and the endocrinologists still use the old system. All right. So here's what the issue is. Remember earlier tonight when I was talking about lab values, I said that how we define a normal lab range is basically what 95% of people fall into when we pull healthy people off the street. Okay. So regarding thyroid, if we pull a bunch of people that feel healthy off of the street, 95% of them will have a TSH less than 5. All right. That's how we got normal. There's been some subsequent studies then, though, that looked at groups of people that said they felt normal and had normal TSH. And when you then do ultrasounds of their thyroid, a number of people were found to have swollen thyroid, suggesting they actually had subclinical low thyroid, right? If you remove everyone out that had swollen thyroid and then go back in and relook at the TSH levels, it appears that a normal range should actually be 2.5 or less. All right. In chronic fatiguing illnesses like Lyme, I have found people do better clinically when they are taking thyroid to keep their TSH at 2.5 or less. And that's what I tend to do. Okay. Now, your endocrinologist doesn't manage chronic fatiguing illnesses and doesn't manage Lyme disease and doesn't understand all the nuances of those illnesses. All right. So regarding the thyroid, disagree with what your endocrinologist is saying and would suggest that probably staying on it. All right. Now, it is also, and I don't fully agree that what happens with thyroid regulates estrogen and estrogen regulates thyroid. I'm not quite sure where she's coming up with that one. He or she is coming up with that one. Oh, no, you said she, how she's coming up with that one. And then regarding perimenopause, yeah, you're going to get estrogen fluctuation during perimenopause. And if it's really bad, sometimes it is helpful to use bioidentical estrogen to do that. So it's not incompatible to use both thyroid and to use bioidentical estrogen. They can be done both at the same time. Okay. All right. So that's how I would approach somebody. If one of my patients came in with the same story, that's how I would approach it. Again, I'm not your doctor. You should be talking to your own doctors about how to approach this, but I appreciate your wanting my opinion on that. Okay. All right. Good luck to you, Gail. Hello, Tarsia. Let's see. Hello, Dr. Ross. 2 questions. Can I use intravenous human immunoglobulin during treatment with herbal antibiotics and while using prescription antibiotics? Are there any specific contraindications or guidelines regarding immunoglobulin during treatment for Lyme and co-infections? I use intravenous immunoglobulin to treat autoimmune encephalitis. All right, let me answer that question first. So no, I mean, I have no problem. I have a number of people that do IVIG, intravenous immunoglobulins. That's called IVIG, everyone. And, you're using that to help turn on the immune system, basically, or to make up for immune system deficits or to deal with the immune reaction, all right? But you can also kill germs still at the same time by using your herbal or prescription antibiotics. There's no contraindication to doing that, okay? All right. Number 2, herx reactions. With herbal antibiotics, Cemento and Banderol, with only 9 drops twice a day, is this expected? How long can it remain without increasing the daily dose? Thanks for your help. So, everyone, again, what herx reactions are, and I think many of you know this, and Torsia, you probably know this too, but as we start killing germs, the immune system, white blood cells will see those dead germ parts and in reaction to that manufacture more cytokines, okay? And those cytokines give you cytokine symptoms, which are pain, fatigue, sleep disturbance, brain fog. That's what a herx reaction is, all right? Now, most people, whenever we start killing germs, it can happen at any dose. The reason with Cemento, which is cat's claw, and Banderol, which is Otoba, that how I start my dosing on those, I have people begin at 5 drops of each twice a day and increase it by 1 drop per day per dose, working up to 30 drops twice a day. And then I advise people, if they get a herx, stop increasing it, still stay on it, but stop increasing and only start going up again once the herx has lifted. Okay. All right. And that's the advice that I give people. And I have found people get herxes at different doses. There are some people that will work their way all the way up to 30 drops twice a day and have no herx reactions at all. There are some people that even starting at 5 drops twice a day will be clobbered by that. Some people find it's 9 drops. And there are some people, when I treat them, we can never get them over 9 drops twice a day. Every time we go over, they get clobbered. And no matter how long they stay at that dose, it never lifts, okay? I would say that if you are getting still herxing after about 7 days at that dose, generally what I would do with my patients then is I would have them decrease the dose back down to 8 drops. I would have them find the most recent dose that wasn't clobbering them and then decrease it there and stay at that dose maybe for a month or so, okay? The other thing, make sure that I tell my patients to do is to make sure that you're doing everything you can to lower cytokines and to limit the herx reactions. So curcumin, that Mariva 500 product I showed you earlier, 500 milligrams 3 times a day. And if you're already on that, then I would double it to 1,000 milligrams 3 times a day. The other thing I would combine with that to limit herx reaction is glutathione. Glutathione can be very helpful too. So think of the curcumin as getting inside your white blood cells and limiting cytokine production, okay? So it interrupts the factory, it breaks up the factory, okay? Think of the glutathione as something that blocks the message getting to the cytokine factory. So it lowers oxidizing agents that trigger your white blood cells to make cytokines, okay? And so that can be an added benefit in trying to control your cytokines. What I like using as my glutathione product is a product made by research nutritionals called Trifortify. They've got good data showing good absorption and a good increase in levels of intracellular glutathione, okay? And so the way to do that is Trifortify either as their orange flavor or their watermelon flavor, and I would do 1 teaspoon a day. You can even go up to 1 teaspoon twice a day too, okay? All right, good luck to you. Hello, Margaret Lee. Let's see here. Hold on here. I have a sip of water. All right, let's see. My daughter is on a gap year to treat Lyme, Bartonella, Babesia. She's treating only with herbals and has improved. Good. Glad to hear that. But I'm worried that she will not be recovered enough to start college this fall. Will assign antibiotics hasten her recovery in your experience? So, maybe not. I wish I had a golden or a great answer for you, but let me kind of talk it through with you, okay? So what I see in my practice is that there are some people that are great at responding to herbal antibiotics and some people don't respond to them at all. It's very individual. And sometimes people don't respond to prescription antibiotics and then they respond to herbal antibiotics, okay? What I do see is that regarding the Lyme germ, herbal antibiotics tend to work about as well as prescription antibiotics. So I like starting people on cat's claw and otoba bark, and I find that those are helpful about 85 to 90% of the time at improving a person's situation. In terms of the alternative to treat the Lyme infection, you could use 2 prescription antibiotic protocols, or you could use a 1 prescription antibiotic and 1 herb protocol, all right? And those have an 85 to 90% chance of helping as well, okay? Right. When it comes to Bartonella, I find that herbal antibiotics work about 70 to 75% of the time, and prescription antibiotic options tend to work about 80 to 85% of the time, all right? So you've got a 10% better chance of getting help from the prescription antibiotic protocol than you do from the herbal, all right? So if your daughter is still having lots of herbal or Bartonella symptoms and she's been treated for about 4 months or so, that's one you might want to consider looking at prescription options, okay? For Babesia, basically prescription options tend to work about 85% of the time, 80 to 85% of the time. I'm sorry, 80 to 85% of the time. And herbal antibiotic options tend to work 75 to 80% of the time. So you got a 5% difference on the Babesia front. And again, if your daughter's been treated for Babesia for about 4 months, you're just not making much headway on those Babesia symptoms, then you might want to look at prescription options there, okay? So it all depends on what's happening in your daughter. Is she getting a good response from the herbal antibiotics? Then you might want to stay on them because she may be in that 70 to 75% and 75 to 80% group that they're supposed to work in or that they can work in. Okay. So yeah, it's very individual. Okay. All right. One other thing to make you aware of is the timeline of improvement. All right. So with the Lyme infection, regardless of whether you're using prescription or you're using herbal antibiotics, here's what you can expect. This is for a person that's had Lyme for a year or more. And this is based on an unpublished study that was presented at ILADS, I think the International Lyme Associated Disease Society meeting about maybe 10 or 15 years ago, somewhere in that time frame. And in the study, the authors put everyone that had Lyme on Biaxin, also known as clarithromycin, and Flagyl. Biaxin treating spirochete, Flagyl treating the cyst form of Lyme. And then they watched what happened. Okay. So what they found is that by 3 months, 30% of people started improving with their Lyme symptoms. By 6 months, 60% of people started having improvements. And by 9 months, 90% of people started having improvements. So keep in mind, by 3 months, 70% of people are not improving on prescription antibiotics. I see the same thing with the herbals too, okay? An average treatment length for Lyme is 1 to 2 years, all right? So regardless of whether you're doing herbal or prescription, the Lyme germ takes a lot of time, unfortunately, okay? Bartonella and Babesia are a different timeline. And the reason they tend to respond more quickly is they replicate more quickly. Things that grow more quickly respond to antibiotics better, okay, or get killed easier by antibiotics. So Bartonella and Babesia, we think, replicate with short cycles. So, for instance, Bartonella replicates every 24 hours. All right. Generally, then what I see is about 85% of people we can get over their Bartonella in 4 to 6 months. About 85% of people with Babesia, we can get over it in 4 to 5 months. All right. So that's your timelines. It takes time. Okay. And then on a Babesia and a Bartonella treatment, you look at what are Bartonella symptoms and you look at what are Babesia symptoms. And each of those symptoms should start improving by 1 to 2 months if you're on something that's working. All right. So major Bartonella symptoms would be night sweats, anxiety attacks, headaches in the front of the head, shortness of breath, we call that air hunger. Racing, skipping of the heart, getting dizzy when you stand up, frequent deja vu. A lot of people with Babesia have frequent deja vu, right? So look at those symptoms, see which one she has that were part of that list, and see if they're starting to improve by 1 to 2 months, all right? Major Bartonella symptoms are severe thinking problems, pain on the bottom of the feet, lots of anxiety, depression, tremors and shakes, internal vibration and buzzing, air hunger also going to be part of Bartonella, and so those would be things to follow as well too. All right. So I'm going to do a quick screen share so you can figure out what the symptoms of Bartonella and the symptoms of Babesia are. I'm going to show you 2 articles that you can reference back to that. Okay. All right, so first of all, this timeline I told you about, I think I have an article on it. Yep. Look at this article called When Will I Start to Feel Better? Lyme, Babesia, and Bartonella Timelines, okay? That will give you it's kind of the information I was just talking about here, okay? And then I don't think, yeah, that's a video. Yeah. All right. So then the other one to take a look at is go into my how to diagnose section here. And for the list of what would be Bartonella symptoms I just went through, click on this, is it Bartonella? And for Babesia, for the list of Babesia symptoms I just mentioned, look at how to diagnose Babesia, this one here. Okay. All right. Good luck to you and good luck to your daughter. Hello, Gail. Again, let's see. Hormones not compounded as too unreliable in dosing. Number 3, do you agree with this? Finally, to reduce hot flashes and sleep, she recommends low-dose paroxetine or bedtime sertraline. Any thoughts on these? But so, all right. So in terms of Gail, this is back to your perimenopause question. So the antidepressant medicines, the SSRIs, and the SNRIs, which is what you've listed here, have been shown to help reduce hot flashes. So they can be useful. Another way to do that is also taking estrogen for, a short-term period of time, maybe a year or so, or 2 years if needed. But yeah, either one of those can be useful. Okay. All right. Good luck to you. Hello, Julia. Hi, Dr. Ross. I'm taking 3 binder blend pills per day consisting of charcoal, clay, and chlorella. My doctor wants me to take 6 pills a day for mold detox. Let's see. You're doing 3. Okay. It's taking me about a month to increase by 1 pill. If I increase too quickly, I get much worse. Is there anything I can do to speed up my intake of these pills without making myself much worse? Okay. So so Julie, let me give you some ideas. Okay. So as you know, earlier tonight I was talking about cytokines, right? So cytokines are those inflammatory chemicals that get made by white blood cells when they see an infection. If you get a Herxheimer where you're killing germs and the immune system sees more dead bug parts, they make more cytokines. Okay, so cytokines get made more. And there's one other situation that can lead to too many cytokines being made, and that is moving mold toxins out of you can trigger the release of more cytokines. It's not technically called a Herxheimer reaction because that's a cytokine release not related to germ killing, but it's a similar response. Okay, all right. So the issue and the trouble is with cytokines is if you we have found in people, especially with mold toxicity illness, that excess cytokines, if you really get too high with them, they can clobber you and keep you down for a long time. All right. So I try to be careful with that. I know many of my colleagues do too. So I think it's okay to have a little bit of increase, but if you're really knocked down by your cytokines, I try to limit that. More and more, I'm going more towards just trying to get my binders in 1 time a day. I used to try to have people take binders 2 or 3 times a day, which gets very complicated. And the reason it gets complicated to do that is, as you probably know, you're not supposed to take your binders with anything else, right? So where do you schedule that time in a day to take your binders? But also, I have found from working in mold toxicity illness now for some time that taking a binders once a day, maybe up to twice a day, you're going to get there over a 6-month period of time, maybe even over a year, but you will get there. And you don't have to clobber yourself to get there. All right. So what I would do is take what you can tolerate, number 1. Okay. And I always tell my patients that I'll have them start at maybe 1 or 2 pills or 1 binder a day. And after they stop having these cytokine surge symptoms, then I'll have them go up to 2 and I'll have them gradually work up. Okay. Right. But because you're worse, because these the mold toxin movement in your body is triggering more cytokines, one way to make it so that you can go up faster is to try to limit your body cytokine production. Okay. And so the way to do that is curcumin, which is that Thorne Mariva 500 product I was mentioning earlier. A maximum dose of that would be 1,000 milligrams 3 times a day. Generally, I have people start at 500 milligrams 3 times a day. And if that's not effective enough, then go up to 1,000 milligrams 3 times a day. Okay. And then the other thing that can be helpful is glutathione. I like having people take the Trifortify product that I mentioned earlier by Research Nutritionals. It's a liposomal glutathione that gets well absorbed. Again, it is going to block the oxidizing messages that go to your white blood cells telling them to make cytokines. So it's going to limit that message getting through to the white blood cells. And for that, I would do a teaspoonful twice a day. That would be a maximum dose on that one too. Okay. So you can get through your detox more quickly and be able to tolerate using your binders more quickly if you're doing things to limit cytokine production. Okay. All right. Good luck to you, Julian. Hello, Carter. Let's see. On the IgG levels, what is the threshold that you choose where somebody should be on IVIG? Is it a threshold of the total or the 4 subclasses or any combination thereof? Thank you. You know, Carter, I don't have a set standard. And so two things. I rarely put people on IVIG. I just want to disclose that. Part of the reason I rarely put people on IVIG is that, number one, insurance won't pay for it. It's very expensive. Insurance may pay for it if you have a small fiber neuropathy, but generally for any other condition, they're just not going to pay for it. Number two, when you get IVIG, there's always risk, okay? So IVIG is made by pooling together donated antibodies collected from multiple different people, all right, from their blood. And even though they try to make sure that these, that where they're getting the blood, these people don't have any chronic infections, it's still possible you may pick up another source of an infection. And in people with Lyme, that's not where I want to go. All right. So I'm going to mainly recommend IVIG if I've got somebody with a small fiber neuropathy that also has documentation of 1 or 2 lowered classes of IG. That tends to be where I do it. I tend not to do IVIG for other conditions. That's just what my practice is. So that's what I would suggest. Okay. All right. Thanks, Carter. Hello, Mosby. Have you seen Lyme disease cause common variable immunodeficiency, or does CVID predispose you to long-term Lyme? Boy, that's a question of what came first, the chicken or the egg. What I don't know that I have seen Lyme cause the variable immunodeficiency. I can't prove that that has happened. I do know that if somebody has immunodeficiency, it makes it harder to get rid of the Lyme, though. Okay. All right. Good luck to you. Hello, Sharon. Let's see. Have you seen circumstances of feather cord or Chiari malformation involved with Lyme disease? I have a lot of cranial instability from muscles and tendon wasting in the neck, and there seems to be a defined subgroup of Lyme sufferers that have problems with spinal fluid flow. So I have not. So I have. I will look for either one of these conditions if I've got a patient with Lyme that I'm treating and we're just not getting rid of their neck pain or some of their pain syndromes up in this area. We'll start to look for it. And I have found that treating the Chiari malformation, if it's there, if we've treated Lyme and nothing is working to reduce the neck and the head symptoms, sometimes we'll actually have them do a repair job, surgical repair of the malformation. All right. That's what my experience has been with it. All right. Thanks, Sharon. Hello, David. Let's see. Are there any particular viruses or bacteria that like to hang out at the sacrum? I'm not aware of that. The tick-borne illnesses hang out everywhere. They're not just hanging out in one set area. So I haven't seen that happen, David. Hello, Tim. Let's see. Hi, Dr. Ross. Oh, I think we answered this one. You wrote it 3 times, it looks like. Hello, Kate. Let's see. If you're not suffering from physical ailments like pain, how can you know whether or not you're on the right dose of low-dose naltrexone? I'm really only taking it to modulate my immune system, and I don't really have any obvious symptoms of anything. as I originally went on it for Lyme, but luckily that's an issue of the past now. Thank you for your response. You know, so low-dose naltrexone, so everyone, naltrexone is a narcotic blocker that we use as manufactured to help people with drug overdose, okay, narcotic drug overdose. And it binds to narcotic or endorphin receptors in our body and basically throws the narcotics that are binding those receptors off, okay? In Lyme disease, we can use it to regulate the immune system, especially autoimmune illness, people that have autoimmune illness as part of their Lyme. And so specifically, we have a group of naturally made narcotics in our body called endorphins, all right? And we have these endorphin receptors. Endorphins that we make to modulate our pain also regulate the immune system, all right? And you can use endorphins to regulate an immune system that is causing autoimmune illness to get it to stop causing that autoimmune illness. And what happens when you do naltrexone, we use it at a low dose. It's manufactured as a 50 milligram pill, but when we dose it anywhere from 1.5 up to 4.5 milligrams a day. That's what makes it low dose. It has to be compounded by a compounding pharmacist. During the time that naltrexone is in you and binding to the naltrexone or the endorphin receptors in the body, there's two things that happen. Number one, the brain does not like that these endorphin receptors are blocked and starts sending out signals to the endorphin producing cells in the body, screaming at them to make more endorphins. And so they make more endorphins, okay? The other thing that happens is these endorphin receptors then become super sensitized to the effects of any endorphins that remain. So in 4 to 6 hours, when the low dose naltrexone wears off of these receptors are super primed for any effects that they have of the endorphins, and they get flooded with all these excess endorphins that have been made. And that can have a benefit of turning down an autoimmune reactive immune system, okay? So what I do with my patients that I put on low-dose naltrexone as part of their Lyme treatment, if I do that, or that have autoimmune illnesses, I will, once they're well, and we remove the thing that might have been triggering their autoimmune illness, like Lyme, okay, we get it under control. Somewhere around 6 months or so down the road, I might try to withdraw the low-dose naltrexone and see if we need it anymore. And if your symptoms come back when you stop it, go back on the low-dose naltrexone. So the only real way to know is to try to stop it, unfortunately. But you should don't stop it on your own. You should talk to your doctor and see what they think about that too. I don't know your full story, but in general, that's how I approach it. Okay? All right. Good luck to you, Kate. Hello, Thomas. Let's see. I have a lot of pain, discomfort, pressure, and tingling at the base of my skull at the atlas. Have you seen this before? So the one thing I would reflect, because I don't know the rest of your story here, is that of the various infections that people get, Lyme, Bartonella, Babesia, Ehrlichia, mold toxin, all that stuff. The one that tends to be associated with neck pain and a crackling of the neck is the Lyme infection. So it might be part of your Lyme. And yeah, I have seen these kind of symptoms before as part of Lyme, actually. Okay. All right. Good luck to you, Thomas. Hello, TJ. Let's see. If a doctor wants to do a spinal fluid tap to rule out MS, what is the specific marker they are looking for? Because other Lyme sufferers have told me not to do a spinal tap unless you absolutely have to. Most of them have had recovery stories of recurring leaks from the puncture site. So multiple sclerosis is a neurologic construct. What do I mean by that? Well, so most neurologic syndromes that we have, basically the way that neurology works is we define a problem based on the symptoms and architectural findings that you have, okay? Most of these conditions that are neurologic conditions don't give any idea what caused those problems to develop. So multiple sclerosis, how do we know you have it? Well, we're looking for certain neurologic constructs. One of those is MRI lesions in certain parts of your spinal cord or your brain, okay? And if you have those neurologic lesions, it's a construct that gives you the diagnosis of multiple sclerosis. If you don't have those, then there are certain protein findings on a spinal tap that can suggest having multiple sclerosis. Also, in a spinal tap, they would be looking for other infections that might, or an infection like syphilis, for instance, or maybe even Lyme, they might look for it that way, to see if there's something else explaining your neurologic symptoms, okay? So the top down, the best way to figure out if you have MS is, what does the MRI show? The next level of findings, if your MRI is normal, there sometimes can be protein findings on a spinal tap that can be suggestive of multiple sclerosis, and they would probably be trying to rule out other neurologic infections that might give you symptoms that look like multiple sclerosis, okay? There is a very, very small percentage of people that get spinal taps that will have spinal leaks, and that can give you ongoing headaches until they patch it. And it's usually done by putting blood in the area where you got the leak, and it often will seal it up, all right? So anyway, those are my comments on that, okay? All right. Good luck to you, TJ. And talk it over with your doctor and see what they have to say too, okay? All right. Hello, Kim. Hi, Dr. Ross. Thank you for all you do in the Lyme community. You're welcome. I'm wondering if you have been using cryptolevis for BART on some of your patients, and if you, I think I see a second part to your question here. Hold on here a minute. And if you have been using cryptolevis for BART, what have the results been so far? Okay, that's good. Fair question. All right, so there is a so many of you are probably familiar with the idea that in the world of Lyme disease and in Bartonella, we now are very much aware in Lyme for about 6 years and in Bartonella for about the last 1 to 2 years. We've become aware that there are different growth phases of the germs. There are growing germs, and there are what are known as hibernator or persister forms of the germs, okay? These persisters probably make up a very small population of the germs, but persisters ignore regular antibiotics. And so the quest has been to try to identify what can treat those persisters. So there's been some research, especially going on out of Johns Hopkins University, out of a lab that was being run by a physician named Ying Zhang. Unfortunately, about a year ago, I understand Ying Zhang went back to China. And I'm not quite sure why he did that, but he was running a very novel lab out of Johns Hopkins. And I'm not quite clear that we are going to see the same number of projects coming out of there. But what he was doing is he was doing them along with other physicians, doing various laboratory experiments, trying to identify what you could use to treat persister forms of Lyme and or Bartonella. So we got some really novel ideas from him. Again, I'm not quite sure we're going to keep seeing that come out of that lab anymore or not. But anyhow, one of the things that that he was able to show in some of his experiments is that cryptolepis, which is an antiparasitic herb that we use traditionally to treat malaria and babesia, his experiments were able to show that it treats growing Lyme and persisting Lyme. It also treats growing Bartonella and persister Bartonella. All right. These were in laboratory experiments. So what Kim is asking is, if I've been using it, does it work? And I have to say, yeah, I've been using it. I've been adding it in. So all of my treatments that are oriented at Lyme and Bartonella these days, I am trying to do something to treat both growing and persister forms at the same time. My favorite agent that I like to use to treat persister Lyme and Bartonella is liposomal cinnamon, clove, and oregano oil. And I have seen some really good results with that. There's a company called Doctor Inspired Formulations that makes something called liposomal cinnamon clove oregano essentials, 1 capsule twice a day. I'm finding good benefits from that. Okay, I get big herx reactions on it. I have a feeling it because of that. I also think it works, and then clinically, I see people improve. But not everyone can take it. All right, because they're essential oils, and they can be really rough on the stomach sometimes. So in people that I'm having a hard time getting them to be able to take the liposomal cinnamon clove oregano essentials, then I start looking at, well, what else can I use? All right. And so one of those is Cryptolepis, and I've been dosing it at a dose I would even use for Babesia, which tends to be a high dose. It's a 5 milliliters 3 times a day. So I dose a really high dose on that. And I'm seeing herx with it. I see some improvement with it. If I had to say what's giving me better results, I would say the cinnamon clove oregano oil. And then in terms of herxing and improvements, I would put, if the effect of a liposomal cinnamon clove oregano oil is a 10 out of 10, then I would say that crypto is about 5 or 6. I mean, I give it helps a lot of people, but it doesn't have quite as good of a chance as the cinnamon clove oregano. So can it work? Yes, not in everyone. I have been using it. I am getting some positive results, but not to the same degree I get with the liposomal cinnamon clove oregano. Okay. All right. Thanks, Kim. I appreciate that question. Let me actually just do a quick screen share here. All right. So the crypto that she was just talking about, the product that I like using for that is this product by Montana Pharmacy. It's a more affordable version of Cryptolepis than you're going to find from other companies, and I'm finding good success with this one. Okay, and then in terms of the cinnamon clove oregano, the product I like using for that is this one by Doctor Inspired Formulations called liposomal cinnamon clove and oregano essentials. And again, I like people doing 1 pill twice a day on this. Okay. All right. Thanks for the question. Good luck to you. Hello, Justin. Let's see. Are there any non-prescription thyroid options? Does this ever cause meningitis? What are the symptoms? Or encephalitis? So I haven't seen hyperthyroid or hypothyroid give meningitis or encephalitis, if that's what you're asking. Okay. In terms of non-prescription thyroid options, I like what I'm going to point you to an article. I see we're starting to run low on time here. Take a look at, turn my screen share on. All right, so look in my hormone section here. Take a look at my hypothyroidism article here. And in terms of things you can do to support your thyroid that are not pharmaceutical, I go through a number of nutrients as well as supports for that. Okay, so read through this article. It's rather long, but down here at the bottom, I go through the other things that you can do. Okay, so one thing is be on a micronutrient that has selenium, zinc, vitamin D, and iodine, and I give you the dosing ranges there. Curcumin can be helpful to lower cytokines that make it so your hormonal systems won't work. So you want to do that. And then finally, where is it? Somewhere here. Somewhere in here. I'm not seeing it quickly here. I also like to put people on ashwagandha. Ashwagandha is a Chinese medicine, Ayurvedic medicine herb that has been shown in animal studies to help both adrenal and thyroid function. And the way I dose that is a 400 milligram pill, 2 pills in the morning and 2 pills between 1 and 2. Okay. And again, then I would also work on vitamin D, zinc, and selenium are essential nutrients that can help your thyroid work better as well too. Okay. All right, everyone. Boy, time flew tonight. I didn't realize it got here so late. So it's that time of night where I get to take my two Basenjis out, my two dogs. So I'm getting ready to do that. It's been good to visit with you all here tonight. I'm glad to be here after being gone the last couple weeks. We will be back here again next week and the Thursday after that. So sign up for that. You can do so tomorrow morning when I send out the email. There'll be links in there to sign up for the next two webinars. I'd like to request something from you. If you all would share the email about the video tomorrow with any of your friends or acquaintances you know that have Lyme that would benefit from these. I want to try to spread this information as much as we can. Also share with them the emails to sign up for the next webinars as well too. Okay, so keep an eye out on your email tomorrow morning. Somewhere between 9:30 a.m. is when I usually have it done. I've got to do some quick edits on it tonight and do a brief summary of it, which is why I don't send it out until tomorrow morning. Okay, all right. So I look forward to seeing everyone next week, and have a good evening, everyone. Good night.